We have 2,028 cases of coronavirus across Victoria. Let me just explain to you, those numbers are a little complex, but more complex than usual. So there's 49 extra cases, but the numbers have only gone up by 41 because 8 cases have been reclassified. Of those new cases, 4 are connected to known outbreaks, so we have those under control. 26 are the result of routine testing, just as I think foreshadowed with you some time ago when we started the Blitz. When you're doing this much testing, particularly in such a targeted way, you are going to finish up picking up more cases. That's exactly the response that we want. And 19 cases are under further investigation. So our contact tracers, that public health team, will be working literally day and night to try and find the source of those positives and to lock down any close contacts of those people. 7 Victorians remain in hospital. Pleasingly, only 1 of those is in intensive care. We did about 18,120 tests yesterday, which I think is a Saturday record. We've done about 40,000 tests for the 2 days of this 3-day suburban Blitz. And again, I take the opportunity to thank every Victorian who has come forward, whether it be to their GP, to a drive-through site, or have agreed to a test and had a test done when someone knocked on your door. It's not necessarily the most pleasant experience, but it is a powerful thing that you can do, and it makes a massive difference for all of us. So I thank each and every one of those more than 40,000 people who've been tested these last 2 days. In total, we are just above the 780,000 tests since January 1. And of course, those numbers will grow as we continue to see more capacity. Particularly, I want to give a shout out to other states who have very generously agreed to process some of those additional tests for us. That lifts our capacity. It just means we can do more, because the challenge here is we have to test in those hotspots, but at the same time we can't take our eye off any other part of the state. We have to keep those testing numbers up to a satisfactory level, so that in trying to track and trace one problem, we aren't necessarily unaware of any other problem that we might have. So a boost in capacity is very, very important. I would also just take this opportunity to give you the full update on the suburban Blitz will be tomorrow and probably into Tuesday. There is some time lag in terms of processing so many tests, but there are literally hundreds and hundreds of people out door knocking as we speak, in Keilor Downs, in Broadmeadows, in a number of other hotspot suburbs. There are thousands of tests that have been taken. The results of those are not yet in any full sense. They'll come in the coming days, but there's been literally an enormous amount of work that's gone in, and I thank every one of the 1,000 people that are out there knocking on doors, to AMBOs, nurses, lab technicians, everybody who's bringing testing literally to people's doorsteps, the end of their street, or certainly to many more drive-through centres or really big testing centres like the Melbourne Showgrounds. All those staff are doing a fantastic job, but again, I just thank all those Victorians in those communities, and indeed in every community, who's come forward and got tested. It is a simple thing, but such a powerful thing. Through that data, that's where we know where we have to target. That's where we know how effective all the different policy settings we have in place are, and it's how we keep Victoria safe and avoid this thing getting away and finishing up having to reimpose the restrictions that no one wants to go back to that unless we absolutely have to. Now, just in relation to hotel quarantine, where National Cabinet and AHPPC have had some thoughts on this, some work's been done on this, I can report that everybody leaving hotel quarantine today has been tested. I can also update you that in terms of the percentage of people in hotel quarantine who have not been tested, it's not in the 70s, it's much, much higher. We've been achieving well into the 80s, and in my latest advice is as high as 85%. I want to just go to this issue of that percentage of people who don't get tested. We do 2 tests, one on day 3, one on day 11. That has now become the national standard. There are, I'm advised, a number of families who've got very small children, and they've not consented to those very small children being tested. I think that we will now move into a much easier phase because the saliva test begins today. And I think what's driven the reticence of some parents to have their often very small children tested is that it's not the most pleasant procedure, particularly for a very small child. But with the saliva test coming on board from today, and again, thanks to the Doherty for their really important work, I think we'll be able to get those numbers right up to 100%. Beyond that though, I'm very pleased to be able to confirm that we, from today, in fact from last night, the orders that actually are the legal instrument that sits behind the hotel quarantine have been changed, and anyone who does not consent to a test will not be able to leave hotel quarantine for a further 10 days, so their stay with us will be 24 days instead of 14. I think the saliva test will mean that that won't necessarily be something we have to do. There is also the opportunity open to us to fine anyone who does not agree to a test. But I'll just make this point. It is my judgment that if it was simply a fine and nothing else, then there may be some people in hotel quarantine, people of means, I'll give you one example, who might well pay the fine in order to get out. 10 days may be a far greater sanction than simply a fine. That option remains open to us, and we would look at that if we needed to. But everybody who's leaving today has been tested, and everybody who leaves from now on, from right now, if they don't agree to a test, then they will be in our care for a total of 24 days, not 14 days. I don't think too many people are going to make that choice, particularly when you now add in the fact that it's no longer the nasal test or the back of the throat test. It will be the saliva test, which is so much easier, so less painful, if you like, and particularly relevant to the smallest of children. So I think that is a very important step forward. Just in terms of other matters, before I ask Brett just to speak to today's numbers and any thoughts he might want to have around trends, I just want to make a couple of comments in relation to what next steps might be. Now, this is not offered to be anything other than just clear with people about what we are thinking about. We're not going to change settings in those hotspot suburbs until we've completed and concluded the blitz. I think that's a fair way to go, and we don't necessarily have those results back until probably about Tuesday, because there is a bit of a lag considering how many tests are being done. But we are doing a power of work to look at what else might be able to be done to contain this virus. Much like a bushfire, putting this out is very challenging. Containing it though is something that we can do, and test and trace is the most effective thing to do. But if we have to further limit movement in some of those suburbs, so for instance a stay-at-home order, much like we all as a community had to endure for what felt like the longest of times, if that is deemed the appropriate public health response, then that is what we will do. I'm not announcing that today, but there's been some talk, I know, in the media today about those sort of suburban lockdowns. I'm hoping it doesn't get to that, and it is another reminder that if people in those communities come forward and get tested, and they have in very strong numbers, but if the numbers are even stronger, well then that will make it less likely that we need to move to those sorts of restrictions being reimposed in given communities. That is not our preference. We'll do it if we need to. We'll do it if that is the appropriate response. But it's again another reminder, and I think just makes the point really clearly. Please come forward and get tested. If someone knocks on your door, take the test. It is incredibly important for you, your family, and every Victorian family. It is a simple thing, but a massive thing when it comes to trying to contain this virus. Given how wildly infectious it is, given how quickly it moves, those test results are critically important to our strategy and critically important to all of us. I now might ask Brett to speak to today's numbers, and then Jenny might want to add some further updates in relation to particularly suburban testing sites, whether they be in hotspots or not. There's been a big ramping up of drive-through sites and other testing sites for people right across the state. And then of course we're happy to take any questions you have.
Thank you, Premier. So out of all of the 49 additional cases today, only 4 have been currently linked to outbreaks. All the others are a result of routine testing or are under investigation. But for many of those, they'll be later linked to outbreaks, and we'll have updates tomorrow that will reflect that. But for the 4 that are known to be associated with outbreaks, one is an additional case in the North Melbourne family outbreak. That brings the total in this outbreak to 21. There's an additional case in the Stanford Plaza outbreak. And as you know, this is a quarantine hotel, but it hasn't led to community transmission. There's been an outbreak associated with it that relates to the staff and their close contacts at home. So it's not a case of transmission from this hotel that's gotten out into the community and has led to broader transmission, just for clarification around that. There's the Coles Keilor Downs family outbreak, so there's an additional staff member now bringing the Coles portion of that outbreak to 4. We'll need to review that in detail today. It's a big facility, it has a lot of staff, hundreds of those have been tested, but we need to do a risk review just to make sure that we're crossing off all of the required actions to make sure that there aren't additional cases coming out of that outbreak. And there's one new case linked to the Brimbank family outbreak, a close contact of a known case. So already quarantining doesn't present a risk to others, but that brings that outbreak number to 6.
Jenny, testing.
Good morning, everyone. So as the Premier explained, our focus has been on finding every single case and making sure people can be isolated, and we have the biggest suburban testing blitz in Australia underway as we speak. So to date, we've had more than 38,000 tests collected across Victoria, but as you'd be aware, there has been concerted effort and activity in particular priority suburbs to make sure we can assist that community to identify cases and to make sure those people are isolated. So to date, we've had more than 11,000 people who have been tested in those priority suburbs, and almost 24,000 homes have been door knocked. So the testing is making it very convenient for those residents. Not only have we established a number of drive-through testing sites in those communities, but we are literally taking testing to their door. So there have been tests offered at people's doorstep. Marquees have been established in people's streets. Vans, including Ambulance Victoria vehicles, have been offering testing in people's streets as well. And we are going to be establishing a number of mobile testing locations at workplaces and other locations where people frequent themselves. So that activity will continue and will increase during the course of the week as we get out to more of those priority suburbs. We are literally having 1,000 people door knocking these homes, as well as 800 people assisting with the testing. And I want to take this opportunity as well to thank ADF members who are assisting us with some of the big fixed location sites, and freeing up our healthcare workers to be part of this testing blitz. So that effort will continue, and during the course of the week, and I just wanted to inform you that we have a number of new testing locations that are opening during the course of this week. Monash University Peninsula Campus on the Murdoch Highway in Frankston will open 7 days a week from tomorrow. Malvern Valley Chadstone will commence testing on Tuesday the 30th of June, and this will replace the Chadstone Shopping Centre. So that will be a very large testing location for that community. The Melbourne Sports and Aquatic Centre will commence testing on Tuesday as well. And during the course of the past week, we've had the following testing locations open, because we're not just focusing only on the priority suburbs, but making sure that all Victorians can continue to access testing, and that is the Great Ocean Road Health in Apollo Bay, Lorne Community Hospital in Lorne, Keilor Community Hub, Bunnings West, Footscray, Craigieburn Centre, Craigieburn, Melbourne Showgrounds, Askervale, and that's proving to be really a mega site for testing. Casey Fields, Cranbourne East is another big mega site. Broadmeadow Shopping Centre, Pakenham IWU Reserve in Pakenham, Fawkner CB Smith Reserve in Fawkner, Braybrook Community Centre in Braybrook, and we've extended the operating hours at a number of our retail drive-through sites. I just want to stress to the community a couple of things. And firstly, that is that the testing is free, and people only need to bring either a Medicare card, or if they're an international student and don't have a Medicare card, just a form of ID. There is absolutely no payment that is involved in being tested. And of course, once someone is tested, if they are symptomatic, they are required to isolate at home until they receive their test result. And the turnaround for that is now at about 3 days, and we ask people for their patience. We're getting a huge volume of tests come through. We have increased our capacity now to about 25,000 tests per day, and we are testing many Victorians. Our government was wanting to ensure that no one had to choose between putting food on the table and getting tested, and you'd be aware that we have recently introduced a hardship payment of $1,500 for individuals who are at home isolating because they're positive or they are a close contact. And it's absolutely imperative for people to comply with the Chief Health Officer's legal direction and stay home if they are in that situation. But we know that some individuals don't have sick leave or other payments that they can access. They can't access JobKeeper, for example, and so we introduced this hardship payment. So I'm pleased to inform you that since those payments have commenced, we've already approved 18 payments, and we've got 84 others that are being processed as we speak. So there are these financial supports for people that are available to them if they require that. So in concluding, can I just say that, look, it's important that all Victorians continue to be tested, even if they have very mild symptoms. Just because you don't live in one of the priority suburbs that's been identified does not mean that you are immune from catching the coronavirus. It's important for the entire state to take this issue very seriously, but particularly for those individuals who do live in the 10 priority suburbs that we have identified. We are urging them to be tested regardless of whether they have symptoms. We are making it easier for people to be tested than ever before. The saliva testing is also starting not just in our hotel quarantine today, but also in our priority suburbs. That's going to make it easier for children to be tested, people with disabilities, the elderly, and of course, whilst that won't replace the traditional swab method that will still be used throughout the state, it's going to make testing far easier for those individuals. So please be tested for yourself and for your loved ones. Even if you have very mild symptoms, this is a very contagious virus, and you could give it to the people you love the most. So we're urging members of those communities in particular to please take up the opportunity to be tested. We're seeing more and more people now, as the message is getting out, agreeing to be tested. Of course, it's a voluntary arrangement, but we are heartened by the fact that more people are agreeing to be tested, and we're working very hard with community leaders in those communities to get that message out. Thank you.
Good. Okay, just before taking the questions, can I just update you on some very detailed discussions that occurred at National Cabinet on Friday. I took the opportunity to inform all of my First Minister colleagues and then Chief Medical Officer Brendan Murphy, and we wish Brendan well and thank him for the leadership that he's provided, the great service that he's provided over these last 15, 16 weeks. I took the opportunity to brief all my colleagues on the response that we have been talking about, the response that we've been able to update you on today, the door knocking, the community engagement, translated material, culturally and faith appropriate material, that army of door knocking, the ADF support that we sought and which we've received, and we're very grateful for that, the mass testing, the really localised focus where those hotspots are. Brendan Murphy took the opportunity to indicate we'd already pre-briefed him before we made the announcements to you guys and the community. He's very comfortable, in fact sees this as a textbook response and one that other states will be, I think, well served by having that clearly demonstrated strategy, a very local strategy, given that outbreaks and indeed additional cases are part and parcel of a suppression strategy. So we're very pleased to have the support of other states and territories. We're very pleased to have the support of the Commonwealth Chief Medical Officer, and I'm very pleased to have the support of the Prime Minister as we deliver this strategy, one that was always going to involve outbreaks and always going to involve additional cases, but it is important that we continue to work really hard in unprecedented terms, in unprecedented ways, to get on top of this spike in cases. I'm confident we've got those settings in place, but if we have to do more, of course we stand ready to do that. Happy to take any questions you've got.
Premier, do you concede that the state lost control of hotel quarantine and it's why we're in this mess now?
No, not at all. What I would say to you is hotel quarantine is a very challenging environment. It cannot be made risk-free. I'll give you a couple of examples of where we think that, not necessarily recent cases, but cases across the journey, where we think some, not community transmission, but where some of those clusters and outbreaks have come from. To the best of our knowledge, we believe that some of those cases may well have come from people sharing a cigarette lighter, keeping their distance, but ultimately sharing a lighter, one between the other. Not a willful breach of anything, but one of those things where, you know, an apparently innocent thing can lead to transmitting the virus. That is how wildly infectious this is. There also seems to have been, and again you can never be certain, but there also seems to be some likelihood that some carpooling arrangements between staff may well have meant that they were in closer contact than you would like. This, as Brendan Murphy noted on Friday, you will never deliver a risk-free model, whether it be home-based, hotel-based, doesn't matter how you do it, you will never be 100% risk-free. The key point though is to remind you of the comments made by the Deputy Chief Health Officer yesterday, in that we've not seen community transmission, we've not seen hotel quarantine, whether it be people who were in hotel quarantine as returned travellers. We've certainly not seen them contribute to the challenges that we face. But look, you work hard every day to make sure that you've got the best arrangements in place, and I would probably end my answer by saying to you that at the beginning of every shift, staff are briefed on what is expected of them. They're, if you like, reminded of all of those infection control protocols, and we review performance at the end of every shift. And any changes that need to be made, there'll be some additional supervision elements to the hotel quarantine. The sheriff is in there now coordinating as one central coordination point. We're going to see more law enforcement in there, not necessarily delivering services, but supervising those who do. And we'll also see more and more health staff, so whether it be nurses and others who've got that clinical training in there doing more of that important work. None of these environments are risk-free. I would of course make the point, which I think is a pretty obvious one, the risks involved in any hotel quarantine arrangement are but a tiny, tiny fraction of what would have presented if we had simply sent the best part of 20,000 people home after having returned from overseas and run a kind of honesty policy where we just assumed that they were never leaving their home. I just don't think that would have worked.
I think a lot of Victorians might be surprised to discover that testing wasn't mandatory for those in hotel quarantine. Why has it taken until now to implement it when New South Wales has been doing it for? No,
that's not the case. It's not been mandatory in New South Wales. In fact, I don't think mandatory testing in New South Wales starts until tomorrow. So, again, it's really important that people understand the context of this. If you've got the virus, so you've actually tested positive, not that you are a returned traveller and we assume that you may have it and you've got to do the 14 days, right? So if you've actually got it and you're isolating at home, there's no test at the end of that ISO. So we just need to keep these things in some sort of perspective. But look, again, for the abundance of caution, the absolute abundance of caution, particularly now that the saliva test is there, there's just no reason why a small child cannot take this test. It was in the judgment of some parents, and I don't want to criticise parents for making a judgment that it would have been unreasonable for their young child to be involved in that nasal test. But now I think that's no longer an issue. With the saliva test coming on board, with the orders having been changed last night, then everyone will be tested, and if they're not, then their stay will be a 24-day stay, not a 14-day stay.
Why the delay in introducing saliva tests? Has there been something out about their
No, obviously the Doherty, which all Victorians and indeed all Australians can be very proud of, it's taken some time to develop that. It's a first for our country, and I think it'll be leading the world in many ways. And we think that that's just going to be a much more practical, a less invasive way of doing it, and we won't be able to do that everywhere, but we'll use it for those priority cohorts. And I took the opportunity to brief National Cabinet on Friday, whether it be in aged care, people who've got complex needs, little kids. There's lots of examples where you can see this just really driving the testing rate up and being a much less invasive way of getting the data that we all absolutely need. So that's been rolled out in really good time. That's starting today.
Premier, there's been some suggestion that Victoria's Human Rights Charter prohibited the government from enforcing return travellers to have that mandatory test. Can you clear that up?
No, that's not right at all. I think that what people should... people are free to observe that we have a human rights charter. That's a fact. But the charter can be waived. The charter has not been a relevant factor in this at all. I want to be really, really clear about that. This is a strategy that is about delivering the greatest good for the greatest number. And that means sometimes we're going to ask a lot of people. And we don't do that lightly. The mere notion that people are returning home to where they live, to a place where they've paid taxes and where they've made a massive contribution, as much as anybody else, they've simply returned from holiday and they have their liberty denied them for 14 days, that's a big step. We didn't take it lightly. We took it because it's the appropriate public health response. So any suggestion to the contrary is simply wrong. We always want to be fair though. We always want to be reasonable. And again, I'm not going to stand here and criticise a mother or a father. And that's not every case, but it is probably the biggest group within the not getting tested group. At least that's the advice I have. I'm not going to criticise mums and dads for not wanting their kids to be tested. That's a very personal thing, but that won't be a choice anymore that they need to make, because with the saliva test, which is simply putting a sample in a small bowl, sealing the lid, putting it in the bag and handing it back to the person who's taken the test, that is really deals with a lot of those issues, I think.
Can you clarify who is manning the hotel quarantine arrangements, why the ADF isn't involved in that, and can you also clarify whether the government has sacked some of those contracting companies for a failure to adequately manage the process? There's
been some changes over the journey. Obviously there's a number of different companies that are involved, and there'll be varying performance whenever you have more than one company, but I don't have any advice as to detailed contractual arrangements, but I know that there's been, as it's scaled up, there's been changes. There's also been changes based on how well people did their job. Again, I'm more than happy to come back to you on that. In terms of management of hotel quarantine, the Sheriff is in charge of the overall coordination. There's some senior bureaucrats that support her in that work. There's then a number of private firms, a number of hotel staff as well. And then there is a really significant presence from a medical point of view or from a clinical point of view, particularly at the hotel where all of the positive cases are housed. That's run by Alfred Health, and it's very much a clinical model because it's essentially like a ward of a hospital.
So the other part of the question though, with the ADF.
Oh, sorry, ADF.
Well, and also just to answer that, police and PSOs, you would have seen speculation that they were going to take.
Yeah, there's been a bit of reports of that. I think you'll see more law enforcement providing that supervisory role. I'll have more to say about that in due course. Just on the ADF issue, let's be very clear about this. I rang the Prime Minister, I asked for 3 things. He's delivered all 3 of those. I'm deeply grateful to him and to the men and women of the Australian Defence Force who are literally on the ground right now doing that important work. If there's a need for any more support, whether it be more tests from laboratories in other states, more public health clinicians, contact tracing experts from other states, or indeed any federal government support, whether it be in a uniform or not, we won't hesitate to ask. As the Prime Minister himself made it very clear, this is fluid, it changes very, very quickly. If you'd said to me a week ago, you're going to have 1,000 people door knocking Keilor Downs and Broadmeadows, I probably would have said no. That isn't right. These things really do change very fast. We've got exactly. Sorry.
Why did you not want ADF in the quarantine?
It's not a matter of not wanting them. The key point is this: they're providing some support in other states to transport people from the airport to the hotel. We looked at whether that would be an option for the ADF to support us. The ADF actually had a look at our arrangements. Skybus is doing a fantastic job, and essentially they made the point that they really wouldn't be doing any different to what Skybus is doing. So it wouldn't be the best use of the resources. So again, requests change, needs change. These things are very fluid, and I'll just make the point again. If you'd said to me a week ago that we would have an army of people, a Victorian army of workforce out there door knocking thousands of homes, I probably would have said no to that. But that's the nature of this. Our response has to try and be as quick as the virus is in spreading, and we know it is a wildly infectious thing.
Brett, can we ask you what you'll be looking at before you consider whether to recommend more localised lockdowns? What sort of numbers do you want to see to avoid that? And I guess your take on the numbers today is 26 in routine testing a lot.
Yeah, certainly numbers today are big, and they've increased day on day. But you really need to wait 5 or 6 days to see in the numbers the effects of whatever interventions you've made. That's the kind of average incubation period for people. So the restrictions in terms of group gatherings and visitors to homes were only made about that length of time ago. And so I would hope that we're getting to a phase now where numbers are plateauing and hopefully driven down. But if it continues to increase, I think those are the circumstances where you think about an additional intervention, and especially if it's localised in a particular postcode or a particular suburb, where there are significant increase in cases where you can't link them to outbreaks, where you can't see where the relationship in all of those cases are. At the moment, as new test results come through, a lot of those, and this will be the case for today, a lot of those get linked back to known clusters and known outbreaks. And we know that people are stepping up for testing. That's a really good sign. But I want to remind everyone that there are 2 essential tools here. One's the test and trace mechanism. The other one is what people do in terms of managing their own illness. So staying at home, getting tested is an absolutely critical one, but minimising the number of people you see, never going to work if you're unwell, never seeing others if you're unwell, they're the other absolutely essential elements, because if we just go down a test and trace pathway, we won't get on top of this. If people continue to visit others, if people continue to turn up to work and transmit to others, because those result in outbreaks and they become very tricky to turn around.
Would checkpoints at one of these hotspots to sort of monitor traffic going in and out be a consideration if you do need to take things further?
I think we'd have to talk through all of the operational details if we ever get to that point. I would strongly encourage it as a kind of last resort. I think you can get strange behaviours if you go down a particular pathway where people move to other suburbs, or people change their behaviour in ways that might increase risk. So I think we have to think through all of that. I would say that the very best approach is to ramp up all of the things that we're doing now. This is really, as the Premier said, a textbook approach in terms of how you respond to outbreaks, and I think if we can get people's cooperation and that behaviour change sustained over the next couple of weeks, then we'll see numbers go down.
Do you think the saliva test is as effective as the nasal swab, and will the saliva test be offered to everyone or just children?
Certainly the saliva test has been validated as a very useful test with very good accuracy. How it measures up against the PCR nasal and throat swab test yet to be seen in this context, but it has a place. It won't be rolled out for absolutely everyone, certainly not at this stage, but I think it's that useful addition, both in terms of not needing the personal protective equipment, because people don't need to receive the test with mask and gown on, and the collection's much easier, and it's obviously not uncomfortable to provide that sample.
So can we drill down into the causes of some of these family outbreaks and be a bit more frank about, people have talked about, say, some of the cultural factors involved. So we'd say the Keilor Downs family outbreak. Do we know now how it started, why it spread to the extent it has, and what are the sort of the cultural factors involved here that means it's hard to consider?
Yeah, look, I won't speak to a specific family, and really these are the same drivers where we see other outbreaks that are complex and run across different locations. The same things occur, that people with very mild symptoms don't stop, get tested, wait for a result before they see others. And so they cross households or they cross settings, including work settings, because people sometimes go to work with very mild symptoms or symptoms that they ascribe to something else, the chronic cough, the smoker's cough, whatever it might be, and they don't say, oh, gee, I wonder if this could be coronavirus, I wonder if I shouldn't be staying at home. So the same things drive all of our outbreaks in that regard. Sometimes people are genuinely not symptomatic, they're about to become symptomatic, and they're still infectious. So, you know, there are people who've essentially not done anything wrong and haven't been symptomatic, but are still transmitting to others. And that's why there's another message there, which is minimise your interactions with other people to the fullest extent that you can. Don't see lots of friends, don't see lots of family members if you can help it. Do your food shopping online, do your retail shopping online in order to minimise that risk where you might just be a day or two from developing symptoms but you're still infectious.
So what you've described there, I mean, that suggests that we should have dozens of these type of outbreaks. I mean, that's a very common kind of explanation for things, but it's very localised, right? So there seems to be something particular going on in these areas that explains why there's these outbreaks.
Well, I think there are certain families that are much larger. There are families that have broader care obligations to extended family members. There are families where the social norms are such that they would see others more frequently. That's what we need to turn around. But that's not just a message for a particular family, that's a message for everyone.
Is it a message for a particular ethnic group? Is there a cultural explanation for this?
Well, I think there are certainly new migrant families that are larger. They have more kids, they have more crowded households. But there should be no vilification in this space. This is a virus that will simply transmit to others if they're close enough.
I'm not up to do a case.
No, I understand.
Just an explanation for why this is happening.
Yeah, look, I think there are different households where people's interactions and the size of those households and how crowded they might be is a factor in transmission, and it's not about people's failure necessarily to do the right thing. But it is a higher risk of transmission in certain settings.
Just one last one. Sorry, because the good news.
Can I add to that?
Yeah,
on the issue that you've raised? I would just make the point, we've all the way through this tried to be as frank as we possibly can, to be as direct as we possibly can, and that's why from time to time I have shared with you things that we are thinking about, things that we are planning. That goes all the way back to that day when we stood at the Royal Melbourne Hospital in that intensive care unit and talked about what we were all in store for. I'll make this point though, and be equally frank. We've had outbreaks from people who've returned from Aspen. If you want to make cultural judgments about that sort of socio-economically and how much money those sorts of people might have, fine. We've had outbreaks at very large weddings. We've had outbreaks connected to hospitality venues and various activities over the journey. We've had outbreaks at a family level. That's the nature of outbreaks. They are very concentrated, they are very localised, and we have had them everywhere. The latest challenge is in larger families in a particular geographic part of the city, and that's why we're literally going door to door to speak to them, to encourage them to get tested and to encourage them to change some of the personal habits that they've always exhibited. Big families getting together with other big families makes for very large gatherings, and if someone's unwell, then that means lots of people leave that gathering positive. They may not know it, some of them may never get symptoms, but again, that's a pretty obvious thing. Just in terms of being equally frank around some of the behaviour that's got us into this place, I think that you can mount a pretty clear argument that when someone tests positive and then goes to work, that's one of the reasons why we find ourselves in the sort of situation we're in now, where without any regard for the safety of others, but perhaps some regard for their household circumstances, the amount of money in their savings account, the mere act of kind of economic survival, they've put that ahead of public health. Rather than blaming that person, what we've done is put that hardship payment in place so that hopefully no one has to make that choice. They can instead have the money, that hardship payment, and do the right thing by their family and every single Victorian family. This virus doesn't discriminate based on where you were born or whether you pray or not and to whom you pray. it is with all of us, and it is with all of us for a long time, and that's why we all have to work together to beat it.
Premier, can you clarify something? Of those return travellers who will refuse the test and will then be fined and forced to stay an extra 10 days, will they have to cover the cost of those extra 10 days in quarantine?
I have seen that suggested quite some time ago. I looked at the notion of charging people for the hotel quarantine. The legal advice to us is that we can't do that. To make somebody pay for their own detention would be a truly unique arrangement. That is not something we use in any of our custodial facilities, and not something that would withstand challenge. So again, you'll get suggestions from different quarters from time to time. It's part of a democratic system, but we've had a good look at that one, and for the purposes of budget, more than anything else, and sadly we're not able to do that. That would have saved the taxpayer $100 million, perhaps more. This is not a cheap thing. It does cost a lot, and even with very low levels of risk, as you get in any kind of quarantine system, it is but a tiny fraction of what the risk would have been if we had allowed people to simply go home, 20,000 people, to go back to their home on a promise to do the right thing. That I just don't think would have been the way to go.
Will the saliva test be eventually rolled out across all testing sites, or is it more likely to remain just a priority test?
Yeah, I think it's much more about priority, but it might well be that, for instance, in a given geographical area where you want to drive the maximum take-up, you might run out many thousands of those tests. But I think in the main it'll be very targeted, whether it be in geography for ease of testing and therefore the rate going up, or for particular cohorts of people for whom either the throat or the nasal swab is perhaps a reason not to take the test. Just on Jodie's earlier question, I would just say I wouldn't assume that we're going to have anybody choosing the 10-day option. I think that we are more likely, particularly now that kids, which is the biggest driver of this not testing challenge, the move to the saliva test is I think a real game changer there. But in the event that we have even a small number of people who won't be tested, then they'll have the pleasure of our company for 24 days, not 14.
Will those travellers have access to the fresh air walk and some of those other procedures, or are you reviewing how that operates?
Everything every day is basically reviewed on how the previous day went. That's, as I said before, there are briefings for all staff at the beginning of each shift. Then there is a proper look back, if you like, over the performance of that day, the performance of the week. That's what a dynamic environment requires. There's similar procedures to those that operate in some of the other custodial facilities that we have across the state. You're going to see some more law enforcement, you're going to see some Corrections Victoria staff in there, and you're going to see more nurses doing that work. Not to do anything other than make sure that we're doubly, triply sure that we've got for the future, because this is going to be with us for quite some time, that we're doubly and triply sure. We can never make it 100% risk-free, but we can drive that risk level down to its lowest level and keep it there. That's what's driving all of us.
Has that changed at all?
Sorry.
Has that fresh air walk that gets on top
I
of that changed?
I don't believe so. I don't believe so. But again, the moment that became in any way a problem, then you would look to maybe change the way that worked. Again, I don't know. I don't think that we necessarily get the greatest outcomes by physically locking people in their rooms 24/7 for 14 days. I think we can, at least these are not my judgments, the medical judgments are that we can have some access to fresh air. That's not a bad thing. Last thing we want to do is to be potentially creating some very, very significant mental health and other behavioural challenges by physically locking people up for 14 days straight. I think that's challenging, but it's not like people are off for a walk in the park. They are supervised. There's a social distancing protocol that needs to be maintained. If at any point that needs to change based on medical advice, then of course right the way through this we've followed medical advice, and we've been so well served by the work that the Chief Health Officer and his deputies have done and will continue to do.
Premier, just on another matter, Adam Somyurek has said that he'll go after his former Labor colleagues. Any comments on what he said to the Herald Sun?
I've got no comment to make on that matter whatsoever. I've got far more important things to focus on, and I am focused on
Premier, just to return
day and night.
Just to return on the cultural issue.
Sure.
The one thing that
I think we're in basic agreement. I think that you need to be frank, but at the same time we also just have to be careful that we're not blaming anybody. No one wants to get this. and I don't think anybody wants to give it to anybody else. And the virus, of course, does not discriminate in any way. We have definitely seen that, from Portsea to Broadmeadows, from dinner parties to family gatherings that are a feature of culture. They're a feature of the fact that everyone's deeply frustrated. Everyone wants to go back to normal, but just because you want it to be over doesn't mean that it is over. This is not over, and there are thousands and thousands of people working day and night. Please work with us. Please do the right thing. Please follow the rules. Please get tested. That's the key message. The government, me and a team of thousands cannot do this on our own. We need Victorians to play their part. It's not over. I understand why people want it to be, but if you're, regardless of age or background, if you are moving around the state considering that this is, oh, well, it's mild and it doesn't matter and I'm fit and healthy and I'll be fine, or, oh, look, it's over, we've avoided the worst of it, you're wrong. You're absolutely wrong. It is not over. It is with us for months and months until we get a vaccine. I take no joy in having to be as clear, be as direct as that, but it's not over, and the fact you want it to be over is no excuse for behaving badly. You've got to do the right thing, every one of us, and if we all do, we'll be much stronger for that. Sorry, Chip.
I was just going to ask you, so by coincidence, Ramadan coincided with pretty much the height of the lockdown, right? Very festive time of the year.
Yes.
So is there any evidence that the sort of the nightly feast, the festivities that go with Ramadan, that led to a spread of the virus or any of these sort of family outbreaks?
I wouldn't draw those sorts of conclusions. I can tell you, I've been to more online iftar dinners this Ramadan than I ever have, and I think the Islamic community, in a broader sense, have been, no different to all of us. Everyone wants this to be over. Everybody wants these rules to no longer be a feature of their life. Again, I don't want to be stereotypical, but I think that larger families potentially, and the notion of a very social culture, people coming together, people meeting and sharing things together, that's really challenging at the moment. And regardless of whether you have faith or no faith, to whom you pray or whether you pray at all, that is not the issue. The issue here is all of us are in this together. I'm so proud to think that just as we provide assistance to other states when they need it, fire, flood, they've done the same for us. I'm deeply grateful for that. I'm deeply grateful to the Prime Minister for his very clear comments on Friday coming out of National Cabinet. This is the strategy. We always knew there would be cases, there would be outbreaks. We're not doing a zero case strategy. If we were to do that, then everything would still be locked down. There would be no restaurants open, no cafes, no hotels. Now, we'll get to a point once we get on top of this where there can be further opening up. But every day where even small numbers of people do the wrong thing puts that opening up at risk, and it certainly puts it further away. We're all in it together and we've all got to play our part, and just because you want it to be over doesn't mean it is. It simply isn't. This is with us for a long time, and the more we can all stay united and consistent and do the right thing, the quicker we'll beat this. Thanks very much, everyone.
Last one, please.
Of the 49 cases today, do we have a figure on how many of those were through community transmission?
No, not yet. They really do come in quite late in the afternoon, evening, and people are already going to bed, so we're not going to pick up the phone and interview them, through the night. But all of that will be done today, and that attribution will be made tomorrow, as it was for yesterday's numbers. Again, with yesterday's numbers of 41, the great majority of those ended up being linked to known outbreaks and clusters. So I imagine it'll be the same for today, but we don't get that information from those notified late last night.
And is it a concern you've got a couple of cases that appear to be linked to high traffic areas like through the street station?
I think you'll see high traffic areas reflected in people's history because high traffic areas get a lot of people going through there. It doesn't mean that they picked it up there, but it is a concern about whether they might have transmitted to others if they've been infectious at that time. So that's another reminder that anyone with symptoms, no matter how mild, needs to keep their distance from others.
just on a happier note, hospital admissions aren't rising, or at least not dramatically. Do you know why?
I think in the same way that we've seen the US cases take off like nothing else, but deaths have continued to fall, there has been a transition to a younger population. They get more mild disease, and so if you haven't got such a vulnerable population affected, and I think we've seen a greater proportion of our recent cases in the 20 to 40 year age group, we're not going to see those people requiring hospital. But the danger still is there, because through all of those cases, they've got potential contacts with people who are more vulnerable, who'll end up in hospital. And if we continue to have cases at 40, 50 a day, unfortunately, we will see deaths associated with it, because it represents a lot of transmission, and there'll be a lot of vulnerable people who are potentially exposed.
And are those vulnerable people mostly still self-isolating, nursing homes, those type of things?
Yeah, I think people who are in the most at-risk group are absolutely being very precautionary, and it's hard to get in there with a message to people who suffer more mild illness. But I would say to anyone who's young, from teenager to 20s or 30s, you don't just think about your family, think about what this might mean in terms of transmission through your entire community, and what the consequences might be for those who are most at risk, because we've seen that it's very hard to protect those most at risk if you've got out of control transmission, even when you've got a strategy to try and protect those, shield those most at risk individuals as much as possible. If you've got really significant transmission, it becomes an enormous task to protect everyone. Thank you.
Everyone right? All good?
Thanks.
Thanks very much.
Thank you.